In chapter 19, adverse effects, poisoning, underdosing, and toxic effects are the most confusing topics. Yes, all these words seems same, but the meaning is different. So in this session, we will learn few example scenarios related to all these topics one by one. Before going to learn example scenarios, we will learn few guidelines related to all these topics. First, we need to understand what is a adverse effect. So, adverse effect is a process where patient will take the medication as prescribed by the physician. So, when coding an adverse effect a drug that has been correctly prescribed and properly administered, assign the appropriate code for the nature of the adverse effect followed by the appropriate code for the adverse effect of the drugs. So for this we need to use T36 to T50 series codes. So what is nature of the adverse effect here? Like tachycardia, delirium, gastrointestinal hemorrhage, vomiting, hypokalemia, hepatitis, renal failure or respiratory failure. So these are the conditions after the patient ingested the medication which is prescribed by the physician. So whenever you want to code adverse effect, first of all, we need to code nature of the adverse effect like all this example tachycardia, delirium like that. Next, we need to code T36 to T50 series code. Next, we will see poisoning. So when coding a poisoning or reaction to the improper use of a medication, first assign the appropriate code from the T36 to T50 series code. If the intent of the poisoning is not known at the time of encounter, we need to consider it as a accidental intent. While coding poisoning, first we need to assign T36 to T50 series code. Then we need to assign nature of the poisoning. What are the common examples of poisoning? Error was made in during prescription or drug prescription. Next one, overdose of a drug intentionally taken. So it is intentionally basically. Next, non-prescribed drug taken with correctly prescribed and properly administered drug. Next one, interaction of drug and alcohol. So these are the examples of poisoning. So in the documentation, whenever you see all these type of scenarios, we need to consider them as poisoning. Next one is underdosing. So it is very simple. So basically, if the patient took the medications less than the physician prescribed, then you will call it as underdosing. Next one, toxic effects. So when a harmful substance is ingested or comes in contact with a person, this is classified as a toxic effect. Most of the time, these toxic effects will be due to chemicals. So if you want to code toxic effects, we need to use 251 to T65 series codes. Whenever you want to code toxic effect, first we need to assign the toxic effect code first, followed by codes for all associated manifestations of the toxic effect. So basically these are the definitions related to adverse effect, poisoning, underdosing as well as toxic effect. Now we will see few example scenarios related to all this. So first one, patient is a cocaine abuser, presents with cocaine induced CP after using few hours prior to arrival. So what is this? Basically this is the poisoning. So as patient is poisoned with cocaine. Cocaine is a drug. Next one, patient is a cocaine abuser, patient with cocaine induced MI. So here also poisoning. Next third one, patient with respiratory failure and change in mental status with absent gag reflex. After study it was determined to be due to heroin, benzos and amphetamines use prior to admission. So basically all these are drug. Because of poisoning of these drug, patient as absent of gag reflex. So we will call it as poisoning. Fourth one, patient presents with respiratory failure and encephalopathy following an attempted suicide attempt with amphetamines. So fourth one is also poisoning. If you feel something is incorrect here, please mention in the comment section. Next one, patient presents with a rash due to taking antibiotic that was prescribed for her son's ear infection. So basically, patient does not have any prescription, but he took his son's antibiotic. So taking others' medication comes under poisoning. Next one is patient presents with severe AKF due to taking a whole bottle of Tums, which is an excess of recommended dose on bottle. So this is also poisoning. So basically, patient took excessive Tums, what is not need to take. So it is also comes under poisoning. Next, seventh one, patient presents with CHF exacerbation after not taking Lasix because they did not like taking the medication due to frequency of urination. So basically here it comes under underdosing. So here patient did not take the medication which is prescribed by the physician. So it will comes under underdosing. Next one, patients presents with nausea and vomiting. PMH includes bipolar and lithium. After study, the patient is diagnosed with lithium toxicity and her prescribed dose was monitored and reduced to appropriate level. So basically, it is an adverse effect. So here, patient took lithium as prescribed by the physician, but due to toxicity of lithium, patient had nausea and vomiting. So this will comes under adverse effect. Next one, patient's presence with GI bleeding. After study, it was thought that the patient had taken extra dose of Coumadin due to forgetfulness due to mild dementia. So here also patient took extra medication which is not prescribed by the physician. You can consider it as a poisoning, not adverse effect. So adverse effect means correct medication taken by the patient. But here patient took extra dose of Coumadin. So it will comes under poisoning. So if anyone looking for jobs in UAE, USA and India, join in our WhatsApp group. Group link is in the description of this video. If anyone looking for same day surgery coding training, IPDRG coding training, SCC coding training and also CCS certification training, please send message to 707-526-3939. And once again, if you like this session, please click on like button.